Good morning, good afternoon, wherever you are. Happy to really be with you here today. And again, I extend my appreciation to BCG, Villgro, and the rest of, most importantly, actually, the cohort that is presently here for being in attendance, and most importantly, the participants. So just to walk you back, and if you vividly recall, late 2019, actually, to be precise, and early 2020, when COVID-19 really set in. And, we had the lockdowns, and this really exposed a lot of our dependencies on other continents, not only on healthcare, but other sectors as well. So in the context of these extraordinary challenges and uncertainties that were brought about, we saw an opportunity that we would be able to, as AUDA-NEPAD, with the support of our partners, ideate on some innovative solutions. So in 2020, we came up with the Homegrown Solutions as a part of our response to the pandemic, where we would support innovative African solutions that show promise to provide resilience in the health sector. Going into late 2020, again, support from JICA and onboarding of BCG and later on Villgro, we really designed the Homegrown Solution Accelerator to strengthen the continent's pandemic resilience. We've now, taken off, and we are working towards a continued support of the healthcare system strengthening in the continent. If you could go to the next slide, please. Yeah, so with the accelerator, we've had to be clearly focused and intentional on where, we want to provide our support, right? As you know, this was a complex problem. And lots of challenges, but in order to get traction and really results, you have to be intentional and focused. So we focused on the healthcare sector, and our priority solutions were oriented towards care capacity and increased digitization, as I'm sure you'll get to hear. Uniquely as well, we focused on company stages that were, first of all, the companies are for profit, and where we've seen clear traction. As the name says, these solutions are homegrown. They are from Africa, for Africa, but of course, appreciating that we work in a dynamic and complex environment where we do sort of involve solutions that can be localized. We're looking after our pilot, which was initially in East Africa, to scale up to a Pan-African footprint, and as we see in the next slide, we really are hoping that we'll be able to get that really African flair going. Our uniqueness is that we're really one of the few large-scale healthcare specific accelerators in Africa, and we work with both growth and mature stage companies, which is a unique kind of position. Go to the next slide, please. Right. So as we said earlier, focused and intentional. So our offering is really in 3 areas. We give context-specific advisory, and again, really good. Our appreciation to BCG and Villgro, who come in with really very, very highly skilled expertise that provide our cohorts with the advice needed in this particular context. We also provide investment readiness support. For example, we match our cohort partners to funding opportunities, broker introductions, and the likes. Last but not least is matching to strategic partners, identifying the right partners, and brokering those introductions. So these are the really 3 areas, and I'm sure as we discuss further, you'll get to hear from the cohort themselves. Next slide, please. Right, so as I mentioned earlier, we initially piloted in East Africa, but our intention is really to be a truly Pan-African Accelerator. And in our scale up in 2022, we had 160 applications, which we whittled down to 20, a short list of 28 and a selection of 4. And really our reach out was across different platforms. And then we hope to continue this next year and as we scale and maintain a steady state in the continent. So this was just a very brief introduction. Today is not the day for us, it's the day for the cohorts, the companies that are here today, for you to really hear about them and their businesses, and let me also afford that opportunity to them with more time. So let me hand it over back to Emmanuel and or Elahe rather, and then we'll get to hear from you. So thank you.
Thank you, George, for that great introduction. I think we can, let me just turn off my video for bandwidth issues. We can go straight into the presentations, and I would like to call on Haptamu of Simbona to present. Simbona is manufacturing UV sterilizers in Ethiopia. Take it away, Haptamu. So feel free to share your screen.
Hello, everybody. Good afternoon, good morning. Hello.
Good afternoon. Yeah. Hello, we can hear you.
Are you hearing me?
Yes.
Yes.
Okay. Can I proceed?
Yes, please proceed.
Is my PowerPoint is visible for you?
Yes, yes.
Okay, good.
Great.
I'm Haptamu Abafoge, the CEO and the co-founder of Simbona Africa healthcare company. This company is a multi-product company in Ethiopia. We have been working to solve the African problems by developing and designing different medical devices because Africa is an area of both challenges and opportunities. When we see the problems in Africa, Africa has a disproportionate share of global healthcare resources, and Africa medical device markets reached around 7.1 billion in 2027. Still, 90% of all these devices are imported. 15% of world population is in Africa, 25% of global disease in Africa. Amazingly, only 1% of healthcare global resources is still in Africa. Also, for modern healthcare access, there is a big challenge because there is less than 50% of access for modern healthcare in Africa. So Simbona, to solve the continents and the Ethiopians' challenges in health sector, have been working on different medical devices, designing and development locally in Africa. For instance, we are working and manufacturing on UV sterilizers, infant radiant warmers, and neonatal phototherapy machines to treat neonatal jaundice treatment and to prevent infant hypothermia in thousands or millions of infants yearly. Those are our products, model products, which is primarily locally designed and manufactured in Ethiopia. Particularly when we talk about the UV sterilizers, this UV sterilizer is mainly very helpful to disinfect or to sterilize any microorganisms from the environment. The research shows that 100 million hospital customers are affected by hospital-acquired infections each year globally. Among these, 1 million patients die due to hospital-acquired infections. In Ethiopia, the research showed that 35% of prevalence of hospital-acquired infections in different health facilities. So the UV sterilizer is a basic solution to prevent such hospital infections in different wards and the medical ICU and ORs. Currently, our company Simbona has manufactured more than 1,900 machines, and 20 plus facilities have get service from this UV sterilizer technologies, which is manufactured by Simbona. So this machine is, its engineering is very simple, but has a huge social impact. It destroys germs in the air and surface of the material within 6.2 meters in 10 minutes. Our product has different models. Specifically, this machine uses light at 254 nanometer to break down the chemical compounds, RNA and DNA, and microorganisms like bacteria, spores, viruses. So preventing their multiplication is just removing these harmful bacteria and viruses from health facilities and from homes. This device mainly integrates with infrared remote controlling mechanism, human body motion detection for the safety, and has an automatic timer and indoor air tracking capabilities. It is highly safe for human beings which are operating the machines. We have 4 different models of UV technologies. Our model, the number 1 model, is the room sterilizer, which can disinfect in the radius of 6.2 meter areas in less than 10 minutes, which disinfect air and surface of the materials, walls, and floors. Another model is UV sterilizer cabinet, the big one, which has been deployed in many hospitals and hotels to disinfect material surfaces that we use commonly. The others are the mini sizes, which is designed based on the customer demands. So our product has its own value propositions. Mainly, we are working to provide affordable UVC room and material surface sterilization machines from any infection and disease-causing microorganisms. Mainly, they are highly affordable, and it took less time to disinfect. It's chemical-free. There is no ecological damage in the environment. Its efficacy is proven by the professors at Juma University and Ethiopian Standard Agency. Currently, in Ethiopia, there is a huge market in health facilities, including hospitals, hotels, beauty salons, and different organizations. Now, when we come to the market size, there is 7.2 million USD of total available market, since 80% of health facilities needs these products. There is $3.6 million market size for serviceable available market, and there is also serviceable obtainable market is $1.2 million. Since all the health facilities, in average, they plan to use 2 units. So to reach our customers, we are using different business model strategies, like business to business and business to customers and subscription. During the business to business currently, we are mainly working with the business to business for different UV cabinets. But for huge machines, we are using business to customers for hospital purposes. There's also $100 subscription per hospital for maintenance purposes. Now, when we come to the revenues and traction, in 2020, when we start this project, we raised 15K USD, in 21, 14K, in 2022. We have raised the annual gross revenue reached 102K USD. It has huge social impact metrics. So we have been impacted more than 200,000 communities in 15 towns of Ethiopia. More than 20 hospitals have been using our product. 11 jobs created because of this UV sterilization technology. Our go-to-market strategy, primarily we target the healthcare facilities in big towns and major towns of Ethiopia through by identifying our target customers like public health centers, hotels, schools, beauty salons, and spas. Our market strategy is mainly bringing the affordable products, promoting our product, and free hospital room disinfection services, like what we did for St. Paul Hospital, which is one of the biggest hospitals in Ethiopia. We have different channels like distributors as business-to-business customers and direct sales business-to-customers strategy, agents, and referrals in different towns of Ethiopia. Our platform to in the market system is we are using the social medias and door-to-door promotion and the TV channels. We had opportunities to use national TV channels 4 times. Our competitors are mainly the hospital sanitation service provider companies with chemical detergents, but most of the time the hospitals have a comment on this sanitation service because of most bacteria are becoming antimicrobacterial resistance. They are not preventable with chemicals. So this UVC is somewhat acceptable in hospital environment. Our mainly we have put the main value proposition for Simbona UVC products: affordability, a year warranty, 30% inexpensive, and 30 maintenance centers. Spare parts are always stocked since we are the manufacturer, and we are also the sole manufacturer for the UVC in Ethiopia. Most of the importers in the case of UVC cabinets have they don't have such values. We are looking for, or we are asking, we are raising 240K in grants or in equity. Among these, 12% is allocated for marketing purpose, 28% is for production to produce the first batch of 1,050 units to reach more towns in Ethiopia. And 10% is allocated for operations to sustain and improve with key hires in sales and the business development and product design, as well as 50% is allocated for equipment purchase. We want to have our own product manufacturing facility. Now we are using outsourcing some machineries from different companies. This is our team. Tamu is me as the co-founder. I'm senior biomedical engineer, experience in medical device installation, maintenance, and design. Mohamed Jamal is a senior mechanical engineer. He has a good experience, and he has been working on a team lead on national defense metal engineering. Samuel Sasai is a certified quality control manager. He's initially a biomedical engineer. And Hannah is operational lead in our company, and she's also a technical manager in Simbona Africa. These are our partners. Villgro Africa is our partner. JICA University, Ministry of Innovation and Technology. Currently, they provide us manufacturing sites for us to start manufacturing in mass in Addis Ababa. IDRC is the one who has been helping us in improving the product efficacy, and UNDP, and as well as the Armor Hansen Research Institute under the Federal Ministry of Health. They are our partners. Thank you so much.
Thank you so much, Tamu, for that presentation. I think we can go to the next company. I'd like to call upon Streamline. You can stop sharing your screen. And in case anyone has questions for Habtamu, kindly just leave those on the chat. Just because of time, maybe we'll just need to move on to the next one. Thanks, Habtamu, for that presentation. I'll call upon Samuel of Streamline to present.
Hello.
Yeah, Habtamu, stop. Good, thanks. Over to you, Samuel.
Thank you very much. Let me try share my screen. I hope you can, just a moment. Just a moment, so get my screen on. Thank you. I'll be live shortly trying to get my screen on. Can you see my screen?
Yes, yes, you can see it.
Is it on the first screen or something? You can see my screen with my name, right?
Yes.
Yeah, thank you very much. A big thanks to the team at HGS and all the work you're doing to support us. Yeah, I'll dive right into it. My name is Samuel Mojisha. I am CEO and co-founder at Streamline Health in Uganda. Let me start off by sharing with you a true story that was published on national television in Uganda. The lady in the picture is Sandra, 81 years old. In May last year, she was diagnosed with uterine cancer and doctors recommended surgery. Sandra's surgery needed about $2,000. For Sandra, this meant two options, either to sell her land or wait to die. Luckily for Sandra, she subscribes to a local community scheme hosted at a local hospital in Uganda. Sandra, with her annual premium of $6 and a co-payment of $120, had her surgery and lives to see better days. At Streamline, we are enabling people like Sandra to access the much needed healthcare at an affordable cost, and I'll share how shortly. So there are 1.2 billion people in Africa, but only 2% have health insurance. Uganda alone has a population of 44 million people, 70% of whom are rural. Data from the Ministry of Health shows that the annual health expenditure is $1.95 billion, of which only 2% is paid through prepayment mechanisms. There is no national health insurance scheme plan for Uganda at the moment. So this is a big problem. We normally refer to this problem as BSD, borrow, sell, or die. According to the World Health Organization, 30% of the households in Africa borrow to pay for healthcare. 15 million pushed into extreme poverty, and an estimated 1.6 million people die due to lack of access to affordable health services. These problems affect the rural people even more severely. So let me explain how the insurance model works. First, people join community schemes in groups and not as individuals. The principle is sharing of risks. We target groups that have existed for at least 2 years to avoid adverse selection, where sick people come together to form a group. These are affinity groups like women groups, savings groups, investment clubs, work associations, farmers groups, etc. Groups usually join with a minimum of 20 households. So we mobilize these groups and then connect them to hospitals. We use an exclusive provider-centric model where groups access healthcare from hospitals in their locations. We target non-for-profit hospitals, majority faith-based, whom we have aligned vision. There are 1,008 non-for-profit hospitals in Uganda, covering the entire Uganda. These hospitals usually serve an average population of 500,000 people and offer full range of services. On the premium side, we make sure that the premiums are affordable for the rural people. The average daily wage for most people in the rural locations is only $2. We ask people to save their daily wage of $2 every month. In a year, it makes $24. This saving covers the insurance of an average family of 4, so individual premiums at $6 annually. This covers all emergency problems and acute diseases up to a maximum limit of $570 US. Beneficiaries also pay co-payments to help top up funds and avoid abuse for minor cases. For outpatient visits, the co-payment is only $1, which covers clinic consultations, lab tests, and drugs. There are also co-payments for surgeries, etc. So this is how Streamline Products enables the whole system to work. Our platform embeds 3 interlinked components. We empower rural hospitals with the electronic medical records platform, which enables to organize their data and provide efficient care. 70% of the health facilities in rural Africa still use paper and pen, so it's difficult to start an insurance scheme because there is no data and systems to use. Hospitals use the Streamline EMR for patient and hospital management. Streamline EMR is unique as it embeds a number of patient safety features to ensure that patients receive quality health care. Our EMR integrates with the insurance module for scheme administration. The scheme administration module enables hospitals to manage scheme members, their premiums, claims, and generating numerous reports key to efficiently manage a scheme. Communities use our mobile app, which is key for signing up beneficiaries. This improves distribution and makes user acquisition and onboarding easy. Then we have Streamline Business Intelligence Platform, which is key, generating analytics, which is key for keeping costs manageable and for health promotion. For instance, in the past, we have been able to spot villages presenting with diseases like diarrhea. The hospital has intervened by fixing water sources in the village. This reduces costs, the insurance scheme, and makes it affordable. We have grown organically over the years. Our journey started in 2015, and we have grown from 2 pilot hospitals to 38, from 0 to 857,000 plus patients served to date. We started piloting our community health insurance module in 2018, and today we have served up to 52,000 beneficiaries in the last 4 years. We have formed key partnerships with the Uganda National Council of Science and Technology, the government arm in charge of innovation, and the Uganda Protestant Medical Bureau, a network of 300 non-for-profit hospitals in Uganda. In 2020, we were recognized as one of the top 5 electronic medical record platforms in Africa by the Tech Emerge program. In September this year, we were selected as winners of the Swiss Re Entrepreneurs for Resilience Award, and we awarded $350,000 to extend insurance cover to more than 150,000 people in the next 2 years. In terms of business model, we offer multiple revenue streams. Hospitals pay license fees to use our EMR platform. These range from $2,920 to $19,000, depending on the size of the hospital, and covers onboarding and support for the first year. Hospitals then pay monthly support fees after the first year. The most common health facilities usually have 21 to 50 users and would pay an average of $6,000 and a monthly support of $100 to $600, most common $243. As part of our electronic medical record sales, we get revenue from research organizations who use our platform for research. We have contracts with the Liverpool School of Tropical Medicine and Center for International Child Health Canada. We hope to build this revenue stream further. In terms of the insurance module, at the moment we charge a one-time fee, which ranges depending on the size of the hospital. Most common hospitals would pay 10,000 setup fees and a monthly recurring fee of $200. We charge $6 premium, out of which $1 is taken by Streamline as commission. So we get a commission of $1 per beneficiary per year. We also offer hardware sales, data migration, and data backup services as part of our offering to the hospitals. In terms of our go-to-market strategy, we leverage networks and other partners. We have established partnerships with the Uganda Protestant Medical Bureau and the Uganda Catholic Medical Bureau, which enable us to cover more than 500 hospital service providers all over Uganda. We also have established partnerships with the Uganda Cooperative Savings and Credit Union, a network of more than 1,300 savings organizations, which will enable us to reach more than 4 million people to join these schemes. In terms of competition, there is competition for from a number of organizations, but Streamline is unique because of our automation and our technology, which makes it possible to offer our solution to many people at scale. Also, our products are designed to be very affordable for rural people and fit for the rural communities. Communities can pay in flexible weekly installments, and this makes it possible for us to be the market leader in this space. We have a strong multidisciplinary team. I lead the team. I hold a master's in advanced computer science and also an MBA from the UK. I have spent the last 10 years building e-health and m-health applications for low resource settings. My colleague Faizo is the CTO and holds a master's in telecommunication engineering and has been offering support, IT support to a number of organizations for the last 8 years. Ian Spillman is our clinical lead with over 30 years of experience in clinical practice in both UK and in Africa. And we have together a team of 22, 5 engineers and 10 operations staff working together to solve this hard challenge. We are raising 600,000 pre-seed round, and this will enable us to expand our offering to Burundi, Kenya, and Mozambique. We live in a world of difference, but together we can make a difference. Come join us on this mission to extend affordable healthcare to the rural populations. Thank you very much.
Thank you so much, Samuel, for that great presentation. Again, just a reminder to attendees and panelists, just feel free to, if you have any question, just drop that on the chat. I will invite Appy Saúde, which is a pharmaceutical B2B and B2B2C platform in Angola. Over to you, Pedro. Feel free to share your screen.
Hi, everyone. Try to share my screen here.
Yes.
Let me know when you can see it. Should be okay now.
Yes, we can see it.
Okay, so morning, everyone. I'd like to introduce Appy Saúde and the work that we have been doing. So starting with the problem. So basically, we are based in Angola, but working on expansion in different countries. So the problem is pharmacy customers cannot easily know the availability and price of medicines or products sold in different pharmacies. They often need to go from pharmacy to pharmacy or try to understand where they can find a specific product at a given price. On the other side, many medium and small pharmacies mostly, they have the products, they have the pricing, but they struggle to have their customers to know which stock they have, so to be visible to them. So there's no easy way for pharmacies to have an online presence. So the whole digitization starts and the pharmacies are kind of left out. What we thought as a solution, and that engages results, is to digitize small and medium pharmacies, mostly, not only, but mostly, their tools and processes, and place all their products and services online. Okay? So it's a complete transformation of the pharmacy. As a result, users find more products than anywhere else because we are digitizing several pharmacies, and their products are becoming online, so the users can find more products that they would in just one single pharmacy. They can save money because it becomes a very interesting marketplace, and pharmacies competes with that. So it becomes very attractive for the users, and it becomes attractive to pharmacies as well because they sell more as they have visibility on their stock. So we found this kind of formula that works very well by providing the product that users need at a very competitive price and having the pharmacy on the other side selling more. So looking at the market balance. So our mission is to list all online and health-related products in real time. This is the work that we have been doing here in Angola. We have, with this, our products is basically, well, we have different channels, web and app. Our app is a regional awarded solution. We have been fortunately awarded with different awards. What we are present in 60+ pharmacies in four major cities here in Angola, with 25,000 active users and 18,000 unique products. 18,000 unique products is about 65 to 70% of the market, we estimate. So basically, we are the largest database of products here in Angola, by far. And when we were saying that users can really find anything in this platform, it's really because we have all the stock, we combine all the stock. A normal pharmacy has between 2,000 to 3,000 unique products. Okay. What happens on the other side is that pharmacies are becoming more and more digital. So if we look at March 2021 and we compare to this year's, we see that our market share went from 5% to 10%. In a context where the market is actually getting smaller. So here in Angola, we have been having, I think, leading now the recession for the past 5 years, 6 years. What is interesting was that the market is kind of shrinking, but our market share is growing because this platform actually goes into the direction of the user who wants to find the products that he needs in a kind of scarcity market as well, and at the right price. So it's very good for the users. It's very good for the pharmacies because they become visible. And we have reached the 10% market share in terms of the pharmacy sales with very little investment on market. So definitely it's a solution that is scalable and that grows even organically, which is a great indicator. So what's our business model? Well, we receive a fee for every purchase that is made online. This is kind of the standard as a marketplace. However, we see digital ads and reporting to the pharma industry as one of the main points and main differentiators of this solution. Why? Because we see today that some manufacturers working with us, they are paying an average 60 cents per user per month, active users. As we grow with more users and more views and more clicks on products, we see that there is a large opportunity to grow. We also have a very good view of the market, of what's happening, what's being sold, what the users are searching for, what pharmacies have, what they don't have. So we have many manufacturers at this point requesting detailed reports of the pharma industry, and we see this solution as highly scalable, as we have integrated with different software of pharmacies at the national level. Okay, so basically our business model is pretty much connected to digital ads, reporting, and the commission related to every purchase that is made through our platform of the users. Okay, so if you look at Africa, so that's where we are focusing. Of course, the pharmaceutical market is huge, 60 billion. We have seen that the expenditure on sales and marketing is, we are being conservative here, it's normally between 3 to 10 to 12%, which would make 1.8 million. And what we intend is to have more or less 10% of what would be that market and sales opportunity. Of course, there's, it depends on different markets where we are. We are at Angola now. We expect this platform to be deployed in different markets. So we are looking at Ghana, Rwanda, Mozambique. And this is a goal to until 2030. Looking at competition and how we differentiate ourselves. If you look at Dawa or other big pharma chains that have the products online, well, those companies are already implementing existing markets. So that's of course an advantage to them. They have more control over their stock quality, and they have higher margins to sell their products, definitely. However, they are pharmacies, they're not platforms. So they have by nature less products than what we have in our platform. So the large portfolio of products that we have, because we are combining stocks from different pharmacies, allows to have a very wide variety of products to propose to the user. Plus, having all pharmacies displayed on the platform allows pharmacies to compete directly on the platform. We are seeing this in Angola the past years. Pharmacies are using discounts, they are using ways to become more visible. So they are really looking at and controlling the price strategy and the products that they need to have more visibility. And of course, well, our disadvantage would be less control over stock. So if you look at ads, basically they are, of course, very large platforms of ads. Google Ads, not the same level at all. But just to give an idea, so these platforms are very wide. So we are focused on health. We are combining users with that concern and that expertise. So we can combine the user condition and the history to propose different solutions, recommendations, etc. Okay. However, of course, it's a smaller network, but it's a smaller network of today. It can grow and it's very, very scalable. We have a team with over 50 years of experience. Myself, I have worked as a solution manager at Huawei. I worked in Total. I worked in the main internet service providers here in Angola. I hold a master's in telecommunication. The other manager is Daniel with an MBA in Japan, in University of Tsukuba, has worked in KPMG, Sumitomo. Darcy Andrade is our senior system analyst, but basically an IT expert with over 20 years of experience. So it's basically a great team with great expertise. And we have been doing this over the past years with very little funding, but the ability to kind of prove a concept. And this is what I've done so far. So what we are looking now and what we are thinking is we have found a formula that works and that makes sense for manufacturers and pharmacies and users. And this has kept us alive and kind of growing. What we are looking now is partners to be able to invest, but also kind of expand with us. We are looking to expand to different markets. We are looking to optimize our ad system in order to allow that user growth. Okay? Definitely there is appetite. We have seen our pilot and deployment in Rwanda, which has made an interesting impact and in terms of results. However, we need to see it at a wider scale, and we are looking for the right partners. That's it. Thank you.
Thank you so much, Pedro, for that presentation.